Uganda has now registered 453 cases of community transmissions and 2 deaths of COVID-19 since the initial outbreak of the disease. In her latest national update, Minister for Health, Dr. Jane Ruth Aceng, has said the sporadic spread of community cases is worrying and is the reason for the rapid assessment survey.
The total population to be sampled is 13,314 persons, and the Ministry of Health will share the results of the rapid assessment accordingly.
In an effort to reduce the pressure on the existing testing facilities, Dr. Aceng says more facilities have been accredited.
Of these, 3 are public, 3 are private, and 6 are research laboratories.
However, the minister has warned health facilities that have not been accredited to desist from misleading the public, taking a swipe at Lubaga Hospital that recently announced they now had the capacity to test for COVID-19.
They must write to us requesting to be accredited as a center, and the lab is assessed and accredited by the committee, and then we can tell the population. So as it stands now, we don't know that lab.
The ministry also explained the circumstances under which a family in Chisenyi, Mengo, was allowed to bury an 80-year-old woman who is said to have tested positive for COVID-19 shortly before her death.
The procedure is when the death is suspected of COVID, a sample is taken, and the team judges the duration which they have to be able to have the results back. But before they don't have the results, they can decide to bury, but the burial must be safe, dignified burial. So this was an oversight of the hospital in Mengo that saw this patient.
Dr. Aceng now wants all health workers to be more vigilant and treat all acute respiratory tract infections, especially pneumonia, with a high index of suspicion.
Failure to identify symptomatic cases is a danger to the healthcare worker, their families, and the patients.
The hope to have the Ugandan curve for COVID-19 flattened seems out of reach, and according to the Ministry of Health, this could be due to complacency from the public ever since the lockdown was relaxed. Walter Mwesije, NTV.